Obamacare. Well, let's talk a little bit more about this, and joining us now is the expert on Obamacare, Nick Tate, New York Times bestselling author of the Obamacare Survival Guide.
Good to be there.
Nick, before we get to Medicare, though, and Obamacare, we have to talk about this New York City police shooting, because that has really just blanketed every topic of the day. I'm sure there's a lot of folks who are showing up for work or at their holiday gatherings talking about this today. And one of the things, the former NYPD police commissioner said, every police officer in this country right now, we've heard about wartime policing right now, the amount of stress level, the execution style, raising the level of stress for these police officers. Talk to us about how this impacts their daily lives on the job and off.
Well, police work is a dangerous business anyway. You are always at risk. But what the research shows is that people who are under chronic stress face particular problems on the heart, mental functions. What happens when you're under chronic stress is it raises the level of stress hormones in your body, cortisol, adrenaline. These put enormous pressure on your heart. They raise your blood pressure. Mental functions. What happens when you're under chronic stress is it raises the level of stress hormones in your body, cortisol, adrenaline. These put enormous pressure on your heart. They raise your blood pressure. And over time, that can lead to heart disease, heart attack. There's also a good body of evidence that suggests that people who face unusually chronic stress have a higher risk for Alzheimer's. It fritzes the brain, essentially, and that leads to problems down the road. So these individuals really are at risk. And it's not just the police officers. It's spouses, it's children, it's families. And so I think we need to look at the wider impact of walking around with essentially a target on your back chronically.
Right, and then just over the weekend also that officer was killed in Tarpon Springs. So a lot of officers are on edge right now. What do you recommend that they should be doing right now? I mean, it's already holidays, you have this going on.
Well,
what should you be doing?
I think we tend to emphasize the impact of stress. It's just stress. Everybody has stress.
But isn't it the #1 killer?
It is. We have yet to see it, but there are people that believe that one day death certificates will reflect that description, stress. So it's really important to treat stress the way you treat other aspects of your health. Diet, fitness, getting a good night's sleep, these are critical. Stress management increasingly is very important. Heart disease is the #1 killer in this country, and stress is a key contributor to that.
Yeah, it doesn't seem to be a shortage of stress for folks in a lot of professions, including doctors right now. And a lot of doctors are finding out very soon that Medicare is reducing payments to more than 257,000 doctors just next year. Nick, what is behind this?
Well, what's driving this is, in fact, changes in the healthcare system that are being driven by Obamacare, by the Affordable Care Act. One of the provisions of the law requires doctors to move to electronic medical records, and those doctors that have not met those deadlines are going to face a reduction and a cost for what they get for Medicare for reimbursing patients. The big picture here is that we're all paying more for healthcare, number one. Number two, there is already a shortage of doctors, and the concern is that as the cost for providing for Medicare patients goes up, it's gone up about 20% in the last decade, what's in fact happening is reimbursements from the federal government is going down. It's only risen by a very small percentage and is being cut, and that is going to likely lead to more doctors saying, I'm not going to be providing for Medicare patients or patients entirely. Many doctors are looking at early retirement or getting out of the business in the profession.
So overall, what's the impact to us?
Well, the big impact, I think, is that a lot of the Obamacare laws, $1 trillion in reforms, are really aimed at reforming the insurance system. But what the law is silent on is what to do about doctor shortages that are already in existence. And about 1 in 5 Americans now live in an area in the country where there's a shortage of primary physicians.
And we have an aging population.
We have
so
an aging
that's
population.
especially
10,000
alarming.
Americans turn 65 every day. So that number is going to grow. The need is going to grow. We have yet to figure out a solution. For consumers, as we're looking to the new year, Medicare patients and folks with new insurance, you need to make sure that your doctor is accepting your insurance. You need to do what you can to make sure you're picking a good doctor. And if you have things that are elective, get on the list early, because the waiting time to seeing a doctor is likely to be long.
In other words, these were the nightmare scenarios that so many folks warned about. Waiting lists for certain procedures, waiting lists to actually get an appointment with doctors. One thing that struck me, Nick, you're saying 1 out of every 5 people in this country right now is having a hard time finding a doctor.
That's right. And over the next 10 years, the number of doctors that we're going to be short in this country, short of need, is going to increase to about 66,000. So that number is certainly going to grow.
But why do we have a shortage of doctors, or that are like doctors, especially that are specific in certain fields? What's causing that?
There are limits on the number of residencies. Residencies are the training programs that medical students go into after they get their medical degree. There are limits because the federal funding through Medicare that pays for those is being held down. So that even though there are a number of medical students who sign up and to complete their work, they are not getting the money they need to do those 4 to 7 year residencies to actually become doctors. And so there's a bottleneck there. So the number of doctors entering or nearing retirement age is growing, and it's not being kept pace by the medical students that are studying and in line to be doctors, and that's where the disparity is.
Do you think there are going to be any changes when the new Congress comes in?
There's going to have to be. I mean, this problem has really not been discussed much in terms of Obamacare and healthcare reform, but doctors and nursing shortages are really kind of the spear point. They're really the foundation of the healthcare system. I believe that Congress and the White House needs to do more to say, this is the critical problem in healthcare reform. If we don't fix this, it doesn't matter what else we do. If you can't see a doctor, what good is your healthcare? What good is your insurance?
Well, you just talked about some of the problems, the bottleneck here. You can't just create new doctors overnight. We know that the Republican Party, in terms of answering Obamacare, have proposed some ideas, very specific ideas in terms of legislation, but how do you make doctors more readily available?
Well, what's interesting is that the number of people, young people who are going into the medical profession, signing up to go to medical school, is actually at record high levels. But what they can't get is they can't get the federal funding they need for the hospitals that provide those doctor training programs, those residencies. So what has to happen, and it does come back to Medicare, we're coming full circle, there needs to be modification of what's happening with Medicare. They need to raise those levels, and they need to take the money in Medicare that's available, raise it so that we're providing for the seniors who really need the care.
It's one of those very difficult issues. Nobody likes to hear about changes to Medicare, but as we are seeing right now with these cuts,
that's right.
The changes are going to happen if you don't properly address the situation.
And you need to be, in the meantime, individual consumers. You need to be a savvy consumer. You need to be shopping. You need to be making sure you're making good choices for your health and for your money.
Yeah, absolutely, especially this time of year. Nick Tate, thanks so much for being with us.
My pleasure.
All right, Nick Tate, New York Times bestselling author of the Obamacare Survival Guide. We still got a lot to go here on America's Forum. Don't forget to stick around. Be with us all day. Midpoint with Ed Berliner is next.